You're listening to the Fix My Feet podcast. Solutions for every step in your journey with the nation's leading foot and ankle specialists.
Hey everybody, welcome back to the Fix My Feet podcast here today with Dr. Evan Lenertz.
Hello.
Foot and ankle surgeon. How you doing, Evan?
Doing well. How are you?
Doing great. I'm Dr. David Waters. For those of you who haven't been listening along, we are board certified foot and ankle surgeons and practice here in central and eastern Nebraska. And here just to talk about some general foot questions and foot issues. And today we're going to jump right into just kind of a quick hitter. 5 things you should know before you go to foot and ankle surgery, whether that's with us or if you're considering having foot and ankle surgery somewhere else and listening in. 5 things that we commonly have to go over with our patients, and I think important for you to ask if you're going to have that discussion with the surgeon. So we'll jump right into these. Number 1 that I have on my list is pain. What are your thoughts about pain with foot and ankle surgery, Dr. Lenertz?
You're definitely right. That's everybody's number one question, because when they think of surgery, obviously there's, probably going to be some things done to the body that could cause some pain afterwards. I think the most important thing that we talk about is that they're likely going to have some level of discomfort. There's going to be an incision. There's going to be manipulation of soft tissue structures. There's going to be movement of bone. There's going to be hardware in there. There's going to be swelling after surgery. So to go into surgery thinking you're going to have a pain-free experience is probably a little bit of a recipe for disaster, because your expectations aren't really going to be in the right place. So we usually counsel people that will manage it as best we can. We have a pretty good regimen we use for patients depending on the procedure they're getting, and we definitely try and make sure we're there even after hours so that we can add things to that regimen if they need something else, because everybody has a little bit different response to things, and so we try and cater it to each patient specifically, and usually people do pretty well with that as long as they're counseled on that expectation going in that it's going to be some discomfort, but we'll keep it manageable for them.
Yeah, I agree with you. I think where patients get in trouble is and maybe sometimes that I or other surgeons don't make a big enough deal about it preoperatively, but people who go in thinking, oh, this is going to be a cakewalk, I'm not going to be in any pain, I'm going to be able to go right back to work the next day. In some cases, there are some procedures where that might be, a reasonable expectation, but most generally it's not. And that's usually where we get into trouble with pain. So I think a firm understanding that you're undergoing a procedure, just like Dr. Leonard said, it typically requires us to move tendons, move bones, do something like that. So there's going to be an inflammatory response afterwards, and that's going to create some pain. And everybody's response is a little bit different to that, but that is definitely something that's going to happen and you should be aware of, and that you should be following whatever regimen that you were given. I think the other thing that I always try to talk to patients about, like for the first few days, we want you to be ahead of the pain. So I tell patients, whether you're in a lot of pain or not, you should be taking the regimen that we give you for the first few days, because that allows you to stay ahead of the pain. Another place I think patients get in trouble with is when they're waiting until they see if they're going to be in pain. And then by the time they realize they're in pain, they're in a lot of pain, and then they're trying to catch up. And so what we had originally recommended as far as the regimen to follow, now that's not enough to get back in front of the pain. And so now we have to double up dosing, and we have to do things that we typically don't like to do when we're managing your pain post-operatively. Any other thoughts on that, Dr. Lenertz?
No, I think that hits it pretty well. That's one of the most important things, because it's difficult to get that in your mind that when everything feels good, numb after surgery, that you were supposed to be staying up on that routine. But it definitely is a benefit when you have a wear off of that block, and now you've already got something in your system. If you're trying to play catch up with tablets that take 45 minutes to take effect, it can be a little bit annoying for people. So that's good advice.
The other thing I think we should talk about are some things we do to try to mitigate pain, and that is blocks. Do you want to just kind of explain to people what a block is and why we use blocks? Because I'm sure a lot of people aren't aware that that's something that's the last 10 or 15 years has become a lot more popular in extremity surgery.
Yeah, blocks, it can range anywhere from just doing, a local block to an area, if it's a small area on the toe or the front of the foot, to more ankle block territory where you're blocking all of the nerves that come down across the ankle joint and trying to block everything that comes into the foot that way. A lot of times we've been moving more towards doing regional blocks with a block behind the knee, which benefits us in several ways because it can be done before surgery. You can hit one nerve and it takes care of most everything that's coming down into the foot. And then it lasts a while. And so patients do well when they wake up because they have a numb leg or at least a decreased pain in their leg and their foot when they wake up. And then that helps them to get through that initial recovery period a little bit more comfortable than they would be otherwise if there wasn't any local anesthesia going in to calm those nerves down. So the other benefit too is that even if you're under general anesthesia, there's still a pain response going on in your body, whether or not you can feel it or whether or not you remember it or know what's happening. And so pain response generally has an inflammatory effect and a problematic effect in terms of healing. And so if we can keep those nerves comfortable and not firing nearly as much with a regional block or a local block, we're also trying to stimulate better healing for you because we're decreasing that inflammation and those stress markers that you're getting from a normal incision or a normal procedure that's causing those nerves to be irritated. So it's kind of a two-pronged thing, but generally it's for patient comfort after surgery and then to hopefully allow you to heal a little bit better after surgery.
Yeah, agreed. I mean, they've been a big change, even since I started practicing, just have really allowed patients, I think, to be a lot more comfortable after surgery. So if your surgeons start talking to you about blocks, which is essentially numbing a certain area of either the foot or the ankle, or like Dr. Lenertz said, the lower leg, that's something I would recommend to most patients. Is the risk on it is very low and the reward on it is very high for pain control after surgery. Number 2 on things you should be thinking about before foot and ankle surgery is recovery time. And just a little tidbit for me, each procedure's recovery time is a little bit different. I mean, we can't cover all the procedures in this little time that we have today, but in general, you should understand what is kind of the general process of recovering from a foot or an ankle procedure. Dr. Lenertz, maybe you can walk people through generally what that recovery kind of looks like for most foot and ankle type things.
For most things, if it's a little more aggressive, a lot of times patients will not be weight bearing. Pretty much anything we do, you're going to have some sort of an assistive device on your foot to keep you protected, whether that's just to protect the incision and keep stress off of that soft tissue. And then there's levels above that, like Dr. Waters mentioned, of just levels of protection we're going to get to in a surgical shoe or a walking boot, or we're getting up to where patients are in a splint or a cast and not putting any weight on that foot. And so it's very procedure dependent. And generally when we're looking at, soft tissue or bone things, we're looking at clinically the level of healing we're getting with the incisions, because we want to make sure that those are improving before we're starting to put a bunch of weight on this thing. And then when we're looking at anything involving hardware or bones healing together, we want to look at x-rays and make sure things are progressing appropriately before we start putting weight, because that can trigger some problems if there isn't adequate healing going on before we start weight bearing these surgical extremities. And then once we're getting to a point where we're starting to put some weight on whatever foot you've had surgery on, there's obviously going to be some changes that come with that, because you've likely been protected for a little bit from all of the forces that are going to be going through that foot. And so when you start walking on it a little bit more normally, especially when we get to a point where we get into a regular shoe, or if you've been non-weight bearing and you're putting some weight on it in a boot, there's going to be some swelling and probably some discomfort that comes with that, because it's a little bit of a change, from what you're used to, and you aren't quite as protected as you were before. So that progression from there, that initial postoperative 6, 8, 10 week mark where we're trying to get you back into a normal shoe and doing some things without a supportive device, that's kind of just the beginning. And most of the times with these procedures, even smaller ones, the feet can stay swollen for quite some time. Generally, a full recovery can take, 9 months to a year. Depending on what you've had done, just because, the incision will remodel. There's changes that happen internally, especially with fusion procedures and with hardware, and swelling takes a while to come out of the lower leg and the foot. And so it can be a process that you kind of have to sign on for when you go for a foot or ankle surgery, knowing that when we say we can get you back into a shoe in a certain amount of time, there's still going to be some growing pains with that. And there's still going to be some transition until we can get you back to where you were before whatever injury you had, or before you started having whatever pain or deformity that we're treating.
Yeah, I mean, that's very well said. I think where patients get frustrated is where they think, hey, I'm going to be back running in like 4 to 6 weeks, that's just not the case. Generally speaking, there are some minor things. Maybe we're taking a cyst off, or maybe, that might be the case. But when you start talking about bigger foot and ankle procedures, you have to realize time back till you're feeling really good. Like Dr. Lenertz said, I always tell patients it takes a good year. That's what I usually tell patients. It's a year process until you're feeling like, wow, I'm starting to feel really good again. That doesn't mean you're not at work. That doesn't mean you're not, running and chasing your kids around or anything like that. It just means you're doing those things, but there's still a little bit of swelling there. There's still a little bit of nerve tingling going on. There's still these little things going on that you're working your way through, and it's nothing but time. It's not something we can speed up. There's not a magic bullet we can give you to get you better faster. Those things take time to work out, for the body to work out through its own process. And so I think patients need to be aware of that before they go to a foot and ankle surgery or do those things. I think in the end, then the surgery is correct and you need it, then it's totally worth it. It's absolutely worth it. But you should be aware that there's definitely recovery on the back end of that. And make sure you're having educated discussions with your surgeon about, what recovery is going to look like and, the timeframes, so that you can make appropriate modifications to your lifestyle, whatever that might be. So any other thoughts about recovery, Dr. Lenertz?
Well, and obviously there's always exceptions to the rule, right? Some people come back and they're not swollen at all and they feel great, and that, things progress really well, and that's great for them, but that's not something to, I don't think, expect. I would say keep your expectations appropriate. And then, if things accelerate a little bit faster, that's awesome. And it does happen. But generally, for the most part, I think, like you said, it can be a process, and it's still, you're usually doing things you like, and being able to stay active and doing all the things that you might not have been able to do before surgery, but you look down and you see one foot's a little bit more swollen than the other. They're not dramatic changes generally as you get closer to a year, but there will be slight differences until we can, fully get you back to normal. And so you're not looking down and seeing anything that you don't like. Yeah.
Exactly. So just to be clear, the first phase, like Dr. Lenertz said, it's all about incision healing. So we're really super conservative usually during that phase. And then the next phase, depending on what you had done, is usually about bone or tendon ligament healing. And so that's another several weeks. Once we feel like that's strong enough, then we would start a more aggressive weight-bearing regimen. So I would say, generally speaking, most of the stuff that we do, patients are starting, and there's some where we will walk them off the table in a boot. But generally, bigger procedures, we're starting walking around 6 to 8 to 10 weeks, somewhere around in there. And then, it's just a progression of slowly bringing you back so that you don't have a setback over the next little while. So I think other things when we talk about recovery is you need to understand what the demands of your job are, because somebody who goes and sits at a desk all day, answers phones, or people come to them at their office, their return to work is going to be a lot quicker than if you're a laborer, if you're a blue collar construction worker, or if you're a farmer or rancher like we deal with out here. The ability to go back to those jobs is going to take a lot longer than somebody doing a desk job or sitting at a bank or in a position where they can work from home. The return to work is going to be a lot quicker in some of those situations than it would be with somebody who is doing a lot of heavy labor with these kinds of things.
Yeah, great point.
Okay. So number one, pain. Realize there's going to be pain. Number two, realize there's a recovery process involved. This is not, instant gratification. Like, it's all better tomorrow. There's a process to getting better here. We kind of covered that. Number three, and something I know patients don't always know everything about, is what should I expect on the day of surgery? Who am I going to see on the day of surgery? Who's going to be involved in the operating room? I always get asked if I'm going to be the one doing the surgery. What should patients expect as far as a little bit of the process the day of the procedure?
Get prepared to see a lot of people.
Yeah.
It's going to be like you're the car and a NASCAR pit crew's working on you. So you're going to come in usually an hour and a half before the surgery or so. Everybody's a little bit different. You're going to see a lot of nurses. You're going to see some anesthesiology providers who are going to talk to you about allergies. They're going to talk about past medical history. They're going to want to know some things so that they can appropriately anesthetize you if it's a general anesthesia or any history of problems with anesthesia, if there's going to be some sort of sedation surgeon, and then they'll probably discuss a block if we've had that discussion with you as well. The nursing staff is going to go through everything with you as well. They're going to set up an IV. They're going to do all sorts of things to get you ready to go back to the OR. And then once you actually get everything set up, you're wheeling back, you've seen the surgeon, they've marked the leg, you've done the consent form, everything like that. When you get to the OR room, there's going to be a separate set of people that you see in there. And so there's generally a nurse in there, a circulating nurse that oversees the other employees in the room. They're going to be getting things set up. They're going to be charting. They're going to be making sure everything is running smoothly. They're going to do safety timeouts to make sure we've got the right patient and the right extremity and we've got the right implants and all those sorts of things. With us in particular, you're also going to have, a surgeon or two surgeons, and then likely a physician assistant in there as well, assisting with things, assisting with positioning, getting the patient moved over to the bed and getting them comfortable before surgery. There's also going to be an anesthesia provider. A lot of places it's CRNA. Occasionally you have an anesthesiologist in there who's going to be taking care of your airway. They're going to be taking care of your comfort and your pain management there. And then there's generally a scrub tech who's going to be assisting the surgeon with all of the hardware and all of the tools that they need during the procedure. And then depending on exactly what procedure you're having, there might be an additional person in there who's going to be in charge of taking x-rays during the case and providing that service through a intraoperative fluoroscopy. And then occasionally there will be another person you probably won't see, but generally there's a representative for a lot of these companies for the hardware or whatever implants are going in. They're there to make sure everything runs smoothly, make sure that everything gets set up appropriately on the table for the surgeon, and that the scrub tech knows kind of the order of things and how to get everything set up so that the surgeon can work as efficiently as possible. So usually a lot of that stuff you'll forget if anesthesia does their job correctly and you wake up and you're in recovery and you're feeling good, and then you're back with the nurses who you were with before you went back to the OR. But that's kind of the general role of things, and it does deviate a little bit depending on the procedure and the location. So
yeah, no. And I think that's just like you said, it's like NASCAR, right? It's a team approach. Totally. Like you see a ton of people, a bunch of nurses. And the other thing I think is important that, sometimes patients have the understanding that it's just me by myself or it's just you by yourself doing the operating, but there is usually a team. Like you said, like it's either two of us together or two surgeons together, or there's a surgeon and a physician assistant, and they're working together to accomplish the surgery. And so although there's an experienced primary surgeon who's overseeing everything, often, so if you're at a teaching institution, you're going to have residents in there who are doctors in training. They're on the job training. They're helping with the surgery. You can have fellows, which is a doctor who's gone through all the on-the-job training, who's getting some additional very specific training on top of that. So there's other people in the room. They're assisting. And the point that I hope people listening walk away with is that everybody is there to make sure the very best thing happens for the patient and that we get the very best result for the patient so that we have adequate help to be able to accomplish all the different parts of the procedure in the safest and most effective way with the least amount of time that they're under anesthesia. And so there are a lot of different faces in there, but understand that truly it is a ginormous team effort every time we do a surgery. Any other thoughts on that, Dr. Lenertz?
I didn't mention the awesome staff that cleans everything after these cases,
true, yeah.
and gets everything washed and sterilized for future cases, cleans the rooms, sterilizes the rooms, makes sure that they're ready to go for the next patient so that everything can run smoothly. They're a huge benefit, and nothing would work without them either. So. Absolutely.
Okay. So we talked about pain. We talked about realistic expectations with recovery. We kind of talked about who you might see the day of the procedure, what that day might look like. The next thing we're going to talk about is what should you expect as far as outcomes with foot and ankle surgery? And I talk about this with all my patients. I think sometimes people are under the misconception that any kind of surgery, this is not unique to foot and ankle surgery, is 100%. Like if I do this, it's 100% going to be better. I'm not going to have any more issues after we do this surgery. And it's going to be smooth sailing once I get through recovery and everything like that. And just so everybody, we're all on the very open and honest front here. Like I tell all patients, there is no 100% with surgery. That does not exist. because everybody's different. Everybody's body reacts differently. There's no 100%. You may have issues afterwards. We try to do surgeries that are time honored, that have been tested, that have a lot of data behind them, that really show good patient outcomes. But there's risk involved when we do surgery. Would you not agree, Dr. Lenertz?
Oh yeah. Yep. And then there's no 100%. There's no 0%. We can't say something will always happen or never happen. Like I said, we, base everything we do on good research and evidence-based medicine. And there's great data showing it's very rare that you get, certain complications and things like that, but there's always that chance. And so there's always a chance for reoccurrence. There's always a chance for problems healing. And that's just, like you said, that's a common theme in any kind of surgery. There's always, those risk factors. And so everything we do with a purpose and make sure that it's the best thing for the patient and that it's something that we feel confident in and that we've seen good results with. But there's always, when you're having a discussion with your provider or your surgeon, just know that that's always a thing to discuss with them. And if they're being honest with you, they're going to tell you that nothing's 100% and that things can happen. And that doesn't mean we can't fix them doing something else or a different procedure or another trip back to the OR. But that is always a risk and something to think about before you have something done, for sure.
Yeah. Realize that it's not unique to surgery. I mean, there's lots of things in life. There's just risk involved. And so that's the same case when it comes to surgery. You're assuming risk. I'm assuming risk as the surgeon. I understand the things that lower the risk, and we do everything we can to lower and take the least risky path forward for everybody involved. But there is risk inherent in surgery. There's risk inherent in taking medication. There's risk inherent in getting in your car today and coming to the office or going to your job. And so we try to do everything we can with really evidence-based approaches to minimize those risks and get the very best outcomes for patients. And sometimes we end up running into some of the complications that come with surgery, but we're here to tackle those things and in the large majority of cases get really good outcomes for patients. Okay, the last little piece we're going to talk about, it's more unique maybe to the foot and ankle world than it is to some other kind of surgical worlds, is you're going to need equipment after you do a foot and ankle surgery. And you're just going to need you need to be aware of maybe some of the things that you're going to need in order to make the outcomes really good, just like we talked about, and mitigate some of the risky behavior that might cause things to fail or fall apart before you're ready for those kinds of things. And so, Dr. Lenertz, some of the equipment that we use, that we're going to use, that your doctor's going to tell you we need to get this, or you might need to get that. Some of it can be prescribed. Some of it you're going to have to go out and purchase some of that equipment that we're going to need to make this successful.
Right off the bat, just stuff to get around with. That's the most important thing that people are usually the most concerned with. And so it's generally whatever's going on the foot that you've had surgery on, because that's either protecting you or helping you walk in a way that's not going to disturb what was done surgically. And so we kind of talked about those a little bit earlier, but you've got kind of those flat, hard-soled surgical shoes that are a little bit more rigid, and so it doesn't allow your foot to bend and torque when you walk. You kind of have to slap-foot it around like a duck a little bit in those, but it helps prevent torque and tension going across the foot if we've done something to the toes, as well as protect your incision. The walking boots are built in a way that they kind of lock up the leg and prevent the tendons from pulling the foot. And there's also a rocker bottom built into those that allows you to kind of roll forward like you would with your normal gait pattern. So if you're walking in one of those, that's kind of what those are built for. It's a little bit more supportive, still allows you to get around with. And then when we're talking about patients who aren't supposed to be putting any weight down and they're non-weight bearing, then we need to look at a few things to help them get around. And so one of the most common things that we prescribe or rent out or recommend patients get is a knee scooter, which is essentially just a scooter with 4 wheels that's got a padded cushion that instead of sitting on, you place your operative knee on it and then you pedal around that way, which works really well for flat areas and flat surfaces. If people have a ranch style home or somewhere that they don't have a lot of stairs, it works really well for that. You can still get around relatively easily, but there's no pressure on that leg. And it's one of those things where you need to be, trained how to use it, make sure you have the upper body strength and the lower body strength to handle it appropriately so that you're not further injuring yourself on one of these assistive devices. Additionally, there's things you probably already heard of, like crutches, 4-point and 2-point walkers that can help you get around for older patients or for people who you just need something to get into the bathroom. Sometimes the knee scooters can be a little bit cumbersome for small, tight quarters, so those can be good for those. Those are probably the main things as far as the ambulation goes and getting around your house.
Yeah, agreed. I mean, number one, of course, is how you going to weight bear. You have one leg down, and those are definitely the options. Additionally, wheelchair. We don't use wheelchairs a lot. They really cause a lot of decompensation of patients if they're going to spend a long time. Sometimes we're forced into a wheelchair type situation, but generally the devices that Dr. Lenertz talked about are the things you need to be thinking about, making sure you have those things to make sure you're ambulatory. Beyond the ambulation side of things, some other things you might want to think about. If you're going to go in a cast or something, you're going to have to keep it dry. So either a bag, around the cast, or they do make shower bags that have a rubber seal at the top. That's something to think about. Some patients like those elevating wedges, for elevation, stack of pillows, something to keep that leg elevated when you're on the couch or in bed is something to think about as far as the elevation goes. Some people get the self-cooling ice packs or the packs that run cool water through there. I think they're great. They're not necessary. It's just as good as ice out of the fridge, and that works.
Bag
good.
Of peas
that works good too. But something to ice is another thing you're definitely going to want to consider during that postoperative period to help control the inflammation in the foot. Those are usually the main things that I talk to patients about. Equipment. Some other things you might consider, and not everybody needs these items, but a chair for the shower. If you're not supposed to be weight bearing, once you get to a point where you shower comfortably, or you have the shower bag, you might want a chair that you can sit on in the shower. Something to consider. If mobility is an issue, transferring is an issue, a raised toilet seat is something that I've worked with a few patients on. So those are just some extra things. Those are definitely not a every patient kind of a scenario type of a thing, but things to be thinking about, and make sure you're thinking about how you're going to navigate your house. Do you have a lot of stairs? Do you have no stairs? Do you have tight spaces? Do you have wide open spaces? Because that makes a world of difference. If you've got wide open bathrooms, getting the knee scooter in there is probably not going to be an issue. If you're in an older house with a very tight bathroom, that knee scooter is not going in the bathroom. It's just going to be too tight. You're not going to be able to maneuver. You're not going to be able to get into position to transfer. So you're going to need crutches or a walker on top of the knee scooter to help you with those kind of tight spaces. So make sure you're making an accurate assessment of your own situation at home with stairs and how much space is in the home, and the kind of vehicles you're driving, getting in and out of those vehicles. How are you going to do that? Do you need a ramp? I just think those are good questions to ask yourself, when you're thinking about doing a surgery, so that you have a good outcome. That's what all this is aimed around. If you can follow our instructions, that's usually your best path to a really good outcome. And that kind of equipment is going to be required for you to follow our instructions in many instances. So any other thoughts on equipment? Dr. Lenertz?
One other niche thing that's not super common, but we do use it sometimes, is those step-up shoes for the other foot. I think a lot of times those walking boots can be a little awkward on the hips, just because it adds a little bit of height to that side. And they do have devices that go on the other foot and strap on, and adds a little bit of height to your other shoe as well, so that it evens you out a little bit and doesn't even up shoes. Correct. I think so they call it. Yeah, that doesn't cause as much hip discomfort and kind of odd limb length discrepancy there. So that's another thing that is an option in case you're somebody who hasn't done well with one of those walking boots, but you're thinking about doing surgery that might require one. So it's not super common, but people do enjoy them when they need it.
Well, good. That's it for today. Just a quick recap of everything. Things you should be thinking about before foot and ankle surgery. 1, pain management. Make sure you understand the regimen that you need to be on and stay on that regimen, and be in good communication with your providers, doctors, PAs about your pain. 2, there will be recovery involved. Make sure you understand the recovery process. Make sure you set appropriate expectations for yourself, for your employer, for your family around you, so that you can have a successful recovery. You don't feel rushed back to anything, get frustrated that you're not back, where you think you should be in 2 weeks, after a major surgery. 3, understanding the day of surgery, lots of people involved, all people there to help you have a really good outcome. But hopefully that puts some anxiety to rest about who you might see the day of surgery, different roles that people play. 4, there is no 100% in surgery. We used time-honored procedures and data-driven procedures to provide the very best outcomes for patients. And just have a good discussion with your surgeon about outcome results and what you should expect after surgery as far as full recovery. 4, and then the last one, especially in the foot and ankle world, there will be some equipment required after surgery. So make sure you have a firm grasp of that equipment. Make sure you have it. Don't be, the thing that drives me crazy about equipment is when I get patients who are supposed to be non-weight bearing, they're trying to drive all over this town to get the equipment together that they needed to have for surgery. So make sure you understand you need a scooter, you need a boot, you need a chair in the shower, and make sure you have that ready to go so that you can feel like you can go home after surgery, relax, and that you have everything ready to go. So I think that's a good synopsis of that. If you have any questions, drop them in the comments. Again, I'm Dr. David Waters. It's Dr. Evan Lenertz. Fix My Feet podcast. Make sure you check us out. We are on social media. We're at Platte River Foot and Ankle on Instagram and Platte River Foot and Ankle Surgeons on Facebook and TikTok. Or you can certainly visit the podcast-specific Facebook page, Fix My Feet. Until next time, thank you.
Thanks, everyone.
Thanks for listening to another episode of the Fix My Feet podcast. To schedule an appointment with one of our providers, visit www.prfootandankle.com.